Hi everyone, it's 3:30 p.m. on October 27th. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us. Today we have Nita Ludwig of the Rock Island County Health Department and Amy Thoreson of the Scutt County Health Department, who are going to talk about some misconceptions of COVID. Nita, let's start off with some Rock Island County numbers, please.
Good afternoon. Today we are reporting one additional death of COVID-19 in our community. And this was a woman in her 60s who had been in a long-term care facility. And the entire staff of the health department offers their sincerest sympathies to this person and their family. That brings the total deaths in Rock Island County now to 101. In addition, we have 54 new COVID-19 cases today, bringing our total to 4,251 total cases. Thank you.
Today, the Iowa Department of Public Health is reporting 4,619 cases of COVID-19 in Scutt County. This includes nearly 600 cases since last Tuesday's press briefing. The total number of deaths in Scutt County is 41. Since our last press briefing on Thursday, 4 additional COVID-19 related deaths of Scutt County residents have been reported. One was an older adult between the ages of 61 and 80, and 3 were elderly adults greater than age 80. It is always hard to report deaths of members of our community. These individuals are not just numbers to us. They're parents, grandparents, spouses, and friends. We have seen too many COVID-19 related deaths reported this month alone. We express our sympathies to the family and friends of these Scutt County residents.
Hi everyone, it's Janet again. I wanted to let you know of a recent situation that we found out about. With our recent surge of COVID-19 cases, our contact tracers are very busy. Unfortunately, so are the scammers. Our contact tracers are calling to break the chain of infection in our communities. We need you to pick up our calls and answer our questions. Contact tracing is a basic and free public health infection control measure. It is also confidential. Your contacts only will be told when they are exposed to the virus. They will not be told your name. We will never, ever ask you or any of your contacts for financial information, payments for services, or your social security number. Anybody who does that is a scammer. Please note the number that called you and alert your local police department. Our contact tracers are working at the Rock Island County Health Department. They are using a statewide data system that calls from this number, 312-777-1999. Even though it's a Chicago number, Rock Island County Health Department workers are calling you. Please pick up. We also might be calling from a health department phone. Those numbers start as 309-558 and then have 4 additional numbers. We also may call from a health department cell phone. Those numbers start as 309-737. In Scutt County, contact tracers will call for the numbers that start 563-326. Thank you very much. Nita, let's start off with your talking points, please.
As we said from day one, this novel coronavirus is just that, novel meaning new. We have watched in real time as our public health and healthcare systems have learned more and more about this virus and associated COVID-19 illness nearly every day. We never expected ourselves to be in a pandemic of global proportions, and we know it would be easier to write off what we hear about COVID-19 as untrue or inflated. It would surely be easier to live our day-to-day lives if the pandemic weren't looming. For these reasons, we hear many misconceptions shared about the virus, sometimes in an effort to downplay it with the hope of living our lives with fewer restrictions at this time. And we want to take today's briefing to help describe some of the misconceptions and provide accurate information. Misconception number 1. Most people with COVID-19 don't get very sick, so it's no big deal. First, it's hard to get a handle on just how many people have COVID-19. Some individuals may have it and don't know it. Some individuals may have such mild symptoms that they don't consider COVID-19 as the cause and therefore don't get tested. Then still there's a group of individuals that we know have COVID-19 because they have tested. This group varies across the spectrum from individuals with very mild symptoms to more severe symptoms to individuals with very serious illness and require hospitalization. Of those individuals with more serious illness, we are hearing reports of individuals having lasting lung issues, long past their actual recovery from the virus. Others end up on ventilators in the intensive care units, and there are others still who do pass away from COVID-19. Remember, individuals that end up contracting COVID-19 will end up falling somewhere on that spectrum in terms of the severity of their illness. There is no magic indicator of whether someone will have mild illness or more severe illness. As the virus continues to spread, it puts individuals who are more vulnerable, such as those who have underlying health conditions or are elderly, at greater risk of catching the virus and then experiencing more severe illness. Misconception number 2, about 99.9% of people aren't at risk of dying from COVID-19. This was a statement that we read recently in our community. Because we do not know exactly how someone's body and immune system will respond to the virus, 100% of people are at risk of dying from coronavirus. You can't turn on the news without hearing a story of a healthy young adult succumbing to this virus. In our own community, we have experienced deaths of individuals from their early 30s to older than 80. The virus itself does not discriminate. Misconception number 3, the PCR test, the test that's used to identify current infections of COVID-19, doesn't really even tell us who could currently spread the virus to others. The PCR test is the current test used to determine if an individual is currently infected with the SARS-CoV-2 virus, which is also known as coronavirus. It detects the genetic material of the SARS-CoV-2 virus, that is the RNA that is currently present. The test is considered to be very reliable. Misconception number 4, the whole virus has been blown out of proportion and will be over or out of the news after the election. Since March 21st, when the first case of COVID-19 was confirmed in a Scutt County resident, and March 22nd for a Rock Island County resident, contact tracers from both health departments have conducted in-depth interviews with more than 90% of the 8,000 individuals that have tested positive in our county. These are individuals who voluntarily tested on showing signs of illness or being in close contact with somebody with COVID-19. These people are real. Their stories are real. Their symptoms are real. This virus is real. While politics may dictate the federal response to the virus will not magically disappear after the election. I can guarantee you that after the outcome of the presidential election is decided, we will continue to have spread of this virus. People will continue to show symptoms. People will continue to test positive for the virus, and we will continue to contact trace to help stop it. And now I will turn it over to Amy Thoreson from Scutt County.
Thanks, Nita. Misconception number 5, we should just let everyone get COVID-19 and then we wouldn't have to worry. Sorry about that. Herd immunity is a real thing, and in this case, a real scary thing. Herd immunity occurs when a high percentage of the community is immune to a disease either through immunizations or prior illness. Attempts to reach herd immunity through exposing people to a virus are scientifically problematic and unethical. Letting COVID-19 spread through populations of any age or health status will lead to unnecessary infections, suffering, and death. Much of this burden would be disproportionately borne by those who are most vulnerable in our community: older adults, individuals with underlying health conditions, and low-income and minority individuals in frontline work who are more at risk for exposure to a virus that is spreading. Misconception number 6, if I already had COVID-19, I don't have to wear a mask. Each day, we learn more about this new virus that's spreading in our community. Current data tells us that COVID-19 antibodies can last in an individual that was infected with the SARS-CoV-2 virus for a short amount of time, although we don't know how long. This means that over time, the individual can once again be at risk of being infected by the virus if they come into contact with an individual who is currently infectious. Conversely, the individual can also once again become infected with the virus and possibly spread it without even knowing they are infected. It remains very important for all individuals to wear a mask, social distance, and stay home when they are sick or waiting for test results to help reduce the spread of this virus. Misconception number 7. I don't have a fever, so I must not have COVID-19. If only it was that easy and measurable. The symptoms of COVID-19 are vast and similar to symptoms of a number of respiratory illnesses and some gastrointestinal illnesses too. Unfortunately, there is no standalone symptom that definitively tells someone they have COVID-19. In talking with our contact tracers that do the interviews, many people actually do not report having a fever. Their symptoms may be as mild as mimicking seasonal allergies or a minor sinus infection. The only way you will know if you have COVID-19 is to get tested. Many employers and other groups are checking temperatures upon entry to businesses and other locations. This isn't because fever is a tell-all for COVID-19. It's because it is one symptom that can be monitored externally. We encourage all who are monitoring temperatures to also ask if individuals are experiencing any other COVID-19 symptoms. Fever, cough, shortness of breath, trouble breathing, new loss of taste or smell, diarrhea, severe headache, or muscle aches. Individuals experiencing any symptoms should stay home and consider getting tested. Misconception number 7. I'm not worried about catching COVID-19 at a gathering, a family gathering, a wedding, or any other type of gathering, because people won't come if they're sick. Boy, do we wish this was true. At these type of events, you could run into any of the following: an individual that has COVID-19 and doesn't know it because they're asymptomatic or their symptoms haven't started yet, an individual that has such mild symptoms that he or she doesn't consider COVID-19 as the cause and goes about his or her business, or an individual that knows he or she has COVID-19 and attends anyway. Unfortunately, we have heard too many stories of individuals knowingly interacting when they have had a positive COVID-19 test. You can know someone, love someone, trust someone, and that person could still have COVID-19 and not know it. Our first recommendation is to not participate in these types of gatherings, especially as they head indoors, because the level of risk of spread of COVID-19 is pretty high. If you must attend a gathering, wear your face mask at all times and keep at least 6 feet of distance between yourself and others who don't live in your household. We know you're all over this. We couldn't agree with you more because we're over it too. We're tired, we're feeling defeated, and we don't have a clear picture of how and when things will change. But this virus isn't done with us. We're at a dangerous point where the willingness of our community to respond is waning, just as the level of virus in our community is increasing. The risk someone has of catching COVID-19 in the community is so much higher now than when we were locked down back in March and April, because the number of cases is so much higher. This virus doesn't care how run down we feel and how frustrated we are. All it needs to spread is close contact and no face coverings and gatherings. And we're headed into that season of Thanksgiving and other winter holidays where those are even more prevalent. The time to act is now.
Thank you, Amy and Nita, for sharing some of this information that we're just wanting to make sure to get accurately out there in the community. We do encourage any of the media partners on the call to type in any questions. I believe we had a first one just with some clarification on the numbers that we reported at the beginning. This briefing is recorded, and so it will be posted on Scott County Health Department's website as well as on our social media pages. So you can find additional information there that we shared. And we also know that a press release will come out after this with some of the details that can help you with that as well. So Scutt County total infections and new infections. So I believe the numbers Amy gave you are total infections, and then the new ones is based on what's reported each day on the coronavirus.iowa.gov website, which updates periodically throughout the day. So we don't typically have an exact new number. Amy had mentioned that there were nearly 600 since the last Tuesday. So
4,619 was the number, with 600 since last Tuesday.
Seeing no additional questions, we will go ahead and conclude for today. We appreciate your support in getting these messages out, and we do look forward to talking with you again. Okay. If someone tests positive, that does not mean that they are infected with the disease, correct? With the PCR test, it is looking at levels of the virus in there. So if you have some additional detailed questions, we can probably connect with one of our medical providers, but that is what the PCR test is measuring. So thank you everyone for joining us today, and we will talk with you soon.